So she can't take any more home to her family. What's the problem here? Keep asking. Nothing for the family. What about this? Something for the family. Hey, that looks a little better, doesn't it? So you need food, you need basket. So I think medical education is a bit like that. Learning medicine is a bit like that. And the facts which people pour into you are like the fruit, are like the vegetables, are like the food, and you can't carry anymore. And you think, what do I do with these facts? It's no good unless you have the skills to use them, the skills of the basket. Now, during this session, we're going to be focusing on facts, because there are people here who are better qualified than me to tell you the facts about the diagnosis and management of prostate cancer. We're going to, where possible, look at the skills and attitudes that you need to manage this patient. Now, when I say this patient, it's a real one. I'm not making this up. So the data you're going to get is real data. Okay, it's a real person. Very well known to me. Okay. Now, all patients are on a journey. From their first moment, sensing that something is wrong. There's a symptom, there's a problem. To the moment when they are either healed or they die. And you, as physicians, as nurses, as healthcare professionals, will walk with them on this journey. The journey is a complicated one, but it always involves relationships between you and the patient. And we'll be looking at some of these relationships. Now, I said we'd use the 7-level model. You don't know what that is. Unfortunately, that's coming in the plenary tomorrow. And I can't reverse it. So I'm going to outline what is this model and how it works. And forgive me, you're going to hear it again in a bit more detail tomorrow. Hey, I'm sorry. So basically, this particular patient was in a foreign country, traveling in a foreign country, passing urine, and noticed that there was some blood. The first thing I want you to notice is patients don't present with diseases. You guys will know a huge amount about diseases. Patients present with problems. And so the art of medicine, the science of medicine, is about problem solving. And if you can't do that, it's no good. All the knowledge about diseases isn't really going to help you, because the patient isn't presenting with, I've got cancer of the prostate. The patient is presenting with hematuria. So that's the first level of the model. This is the 7-level model, and the first level is the level of symptoms. This is where you come in, this is where the patient comes in. Maybe disabilities as well, but symptoms. So hematuria. So, common causes of hematuria in a man of 55, 60. No? Blood in the urine? Then shout out, what do you do? Any cause. And I'm quite deaf, so you can shout out. Glomerulonephritis, okay. What about a macroscopic hematuria? That one might cover the urine, certainly. Trauma, yep. Okay, so you can think of quite a number of causes of microscopic and macroscopic, gross, painful, painless hematuria, depending on what the patient says. Now, cancer of the prostate, in many studies, only accounts for 5% of the patients who come with hematuria. So if you like, it's not a very common cause of hematuria. Now, here's the skill, here's the attitude. Remember to know a lot about diseases which you can do something about, and are serious if you don't do something about. Especially if they're common, or common causes of death. Those are the ones you need to do a lot about. Don't worry so much about diseases which are rare and you can't do anything about them anyway. Of course you need to know something, but focus on this sort of thing. Okay, so what about the symptoms of prostate cancer? We mentioned that this patient complained of hematuria, which is a symptom, but an uncommon one. What other symptoms might they complain of? These might have difficulty passing the urine. Yes, blood. Pain in passing urine. Why might that be, do you think? Why should they have pain? It's not the cancer that causes it so much, it's
the referred pain.
okay, urinary tract infection because you've got outflow tract obstruction when you've got a greatly enlarged prostate, and it comes somewhat later in the disease. So secondary urinary tract infection. So nobody mentioned none. That's actually the commonest symptom. Somebody's diagnosed with prostate cancer with a PSA, a prostate-specific antigen, taken for some other reason, or for screening, they haven't got any symptoms. So, gentlemen, you're too young, you're too young. Actually, most of you are too young. However, the bad news is that many of you will get cancer of the prostate. It's a common problem. It's a common cause of death. So that's not quite true. Most patients with cancer of the prostate in the West die of something else. But it's very common in men. Don't they say that patients of 90, and a group of men of 90% of them have got some sort of prostate cancer. So, all the men now are listening very hard, the women are relaxing, because you're not going to get this. You have plenty of troubles of your own. However, you will almost certainly look after a patient with prostate cancer. And my experience of women doctors, you look after them very well. Very well indeed. So, none. So, frequency, painful urination, delay or hesitancy before urinating, feeling that the bladder hasn't emptied completely. These are bladder neck obstruction type symptoms. Blood in the urine, uncommon. And it's when you get advanced. I'm sorry, am I speaking too quickly? Are you sure? Yeah. Because I tend to get a bit excited. By the way, I forgot to say, please interrupt. You can interrupt me if I'm not making it clear or I've said something completely wrong. I do this. It's what happens when you get a bit older. It's when you get advanced prostate cancer, that's a very late symptom of any cancer, but bone pain and pains in the pelvis or the lower back, that's often related to bone pain, or maybe hypernephrosis. So those are the symptoms you're going to look out for. A bit non-specific. And I see people writing, it's a good thing to write because it helps you remember, but don't forget you will be given this, always. It's yours. Okay. So, the next level, you talked about the symptoms. The next level, at which the disease of prostate cancer shows itself, these are the levels of a disease showing itself, its manifestations, is the level of signs. So, correct examination will show an enlarged prostate. Anything else that will show? It will be enlarged and the posterior lobe is enlarged, and anything else about it? It may be tender, but something a little more significant. Sorry, somebody said something.
Like hyperplasia?
Well, what you feel? What you feel like? Enlarged and maybe tender and hard is good. Rock hard. And anything else? Irregular. Something irregular. You won't feel redness. Okay. So feel it will be irregular, hard, and possibly tender. Maybe some associated prostatitis. Okay. Here's the patient's spine X-ray. What are the abnormalities here, do you think?
Scoliosis.
A scoliosis, yes. Any clues that cause the scoliosis? No, not really. There aren't, and in this particular patient, the scoliosis is incidental. It's a long-standing. But if the patient had a fracture or wedge fracture, they might have got a compensatory scoliosis. Any other abnormalities?
Is it the bladder? The downside.
I think bladder's down here somewhere.
Expanded.
How about that? It's a little bit difficult to tell with all the light coming in, and I can't get the light rid of the light. But that, and maybe that, compared to that.
Calcification? Calcification?
Calcification. Yes, did you say calcification?
No.
Yes, you did.
Calcification or calcification?
Ossification. Okay. They are bones, so they are ossified. But there is an abnormality there. Do they look normal to you? No, they don't really, do they? What do they look like? How do you describe it? Use the words. What words would you use? If somebody said, describe that vertebra compared to that one compared to that one. Its opacity, okay, there's increased density or opacity of that particular vertebra. It's radiodense. It's osteosclerotic, in fact. It's an osteosclerotic vertebra. What does that suggest to you in this particular patient? No ideas? A low level of calcium? Why do you think it might affect one vertebra and not the others? Because you'd expect generalised disorders of calcium metabolism to affect the skeleton rather evenly. It looks like there's something rather localised. Speak loudly because I'm quite deaf. No, one person. Sorry?
Metastasis.
Okay, metastatic disease. And the secondaries from carcinoma of the prostate are rather typically osteosclerotic, aren't they? That means they're radiodense. So this patient actually has quite a large number of secondaries. You can see the radiological changes here. What you can't see is that there's partial collapse and destruction of vertebral body up here. You can't see that on this X-ray because it's not designed to show it. But the patient developed some pain up there in about D8, something like that. Okay. Now here's the bone scan of the patient, radioisotope bone scan. What do you see here? Have you seen one of these before? So just stick your hand up if you have seen one before. A bone scan, radioisotope bone scan. Nobody has. Okay, that's fine. Well, look at the back. Do all the vertebrae look the same? No, they don't. You remember what we